is there a lifestyle change that they need to do before an egg freezing? Is that something? I just wanted to ask you because that's also a couple of questions about lifestyle changes they need to make before IUI, IVF and egg freezing. Is it all similar?
See, any lifestyle change which will probably reducing weight or healthy eating, working out, all these things will ultimately help you. But we should always have an idea, no? Because a lot of people ask this question. For me at that point of time is now when a patient comes at 38 years or 39 years and tell me that now what should I change in my lifestyle and then do a treatment, I said do the treatment first is your best option.
Yes.
So when you have time, you can always spend that time, improve everything and then do the treatment. Okay, if you ask me what is an ideal scenario, yes, you do all this drinking, you wait for that, you give that time and then you prepare yourself and then do the treatment. Yes, it's the most ideal scenario. But then the 2-3 months that I waste is 2-3 months that I am wasting of an egg quality that I would have got 3 months earlier.
Yeah.
So in these are scenarios where I would rather want to do a treatment faster, because we end up having a lot of these obese patients who come to us. Yes, if you ask me, yes, you need to correct obesity before you do any treatment. But a lot of people are there who cannot correct it. So now me telling them that no, I will only do a treatment when you lose weight or something, it's practically not possible. So we should always give them an opportunity. If you have the time, if you feel that now giving them time to lose weight is not really going to affect your treatment or decrease your chance of getting pregnancy, I will always tell them, okay, let's work out in that way. If otherwise, if I feel that I would say that okay, we know that accepting or understanding all these complications, we will go ahead with the treatment, because getting you pregnant faster is more important at this point of time.
Yes.
So it all depends on patient to patient, person to person. So we'll have to counsel them accordingly at that point of time.
But irrespective of their age and their time, it's always better to just have a proper lifestyle when you're doing a process.
I think the whole whether it's not just about being a process, getting pregnant. Lifestyle is a major factor of even getting pregnant naturally.
Yeah, but I'm talking about egg freezing, doctor.
Yeah, egg freezing also, yes.
To get the best quality out, right?
Yeah,
so
definitely,
it's better to change and
especially
tweak
smoking and especially I think one of the reasons why they say egg quality is deteriorating in the recent years is increase smoking in women is one of the reasons where the egg quality is deteriorating faster compared to what was there earlier. Another very funny, I wouldn't say funny, but then unfortunate fact is that if you look at European women or the Caucasians, they generally tend to have their egg quality slightly better than the Indian, because they tend to get pregnant even with a slightly higher age compared to, like say, our 38 years is their 40 years or 41 years.
Yes, because one of my gynecologists there in London, she did say that Indians, their uterus age faster, and I didn't understand what she was trying to tell me. She was trying to put it across that they have better time frame than what we Indians do. South Asians
more than the uterus, it's the ovaries or the eggs. That basically.
This is what she had used, that language. I was like, what is she talking about? I felt a little bit offended, but I get what you're saying. Is that because of
whether it's something to do with the group of people, or is it the I would know whether the genetics or whether it is something to do with the evolution of the people around this area, whatever it is. But what is there is there. It is slightly. It is a proven thing. We have enough evidence which say that yes, our oocyte aging is slightly higher than the European. So whenever we talk to young, I wouldn't say people who are who are say 35, my friend is 39, she's had a baby, their European friend, it's not very difficult for them, they had a normal delivery, they went. But yes, it's true, but the problem is that it's become more and more difficult. So the challenge here is that you miss that opportunity, Sometimes things will happen normally also. I'm not saying it will not happen normally, but how long do you wait for it, or how long do you waste your time on it? If it does not work, then there's no going back. And you miss that bus, you miss that the egg quality completely goes down, then you cannot go back and check. So that is a big challenge.